A high-level delegation comprised of global health leaders and sponsors of the WHO was in Bahrain this week to evaluate the quality of health policies and services in the kingdom. Bahrain is one of the first countries to go through this evaluation process, and the results are promising. Mohamed Al-Shaaban has more details in this report.
A joint external evaluation mission concluded its work tour of Bahrain today. A WHO-sponsored mission, which is comprised of leading global experts in the fields of health protection and management, conducted various field visits to assess and evaluate the systems and services provided in the kingdom.
It seems that the number of countries had done all this, only 13, and Bahrain I think is one of the earliest countries that are doing this. So I think all this monitoring and things that about regulation, how you are dealing with the things that infection, relating kind of diseases, the relation between the infections of human beings with the animals and with this kind of thing actually affect the whole thing. So I think this kind of thing is very important.
The visit, which kicked off on the 4th of September and lasted for 5 days, involved a number of meetings and technical area discussions with different officials and health and government entities on current and future policies and strategies. The 15 experts also toured the kingdom's facilities to take a closer look at the way of work and quality of services.
The mission is aiming at improving countries' capacities to prevent, detect and respond to different kind of health threats. This is an international initiative. WHO has a strong role in it, but there are also other organizations including FAO, OIA and experts from different countries.
The WHO has conducted similar visits in other countries. Bahrain opted to have this mission take place and welcomed it with open arms as it works towards its vision of sustainable quality and excellence.
This joint external evaluation has so far been conducted in 12 countries globally, and our understanding is that Bahrain has excellent capacities in many of the international health regulation areas.
And the Kingdom of Bahrain remains adamant to continue to re-evaluate and better its services across all platforms and according to the global standards to present the best to its citizens. Mohamed Al-Shaaban, Bahrain Television News.
And for more on the results of the visit from an international delegation sponsored by the World Health Organization to the Kingdom of Bahrain, we're joined in the studio by Chief Physician and Head of the Vaccination Programme Unit at the National Institute for Health and Welfare in Finland, Dr. Tenali Pumalainen. Good evening, Dr. Tenali. Thank you for joining us.
You're welcome.
How is your evaluation of the developments of Bahrain's healthcare system?
First of all, we were not able to evaluate the whole healthcare system. We were concentrating on especially health security and sections of healthcare which are especially relevant when it comes to international health regulations and issues like current Zika virus or coronavirus or any of the infectious diseases, or maybe also accidents or other type of natural catastrophes which may face any country.
And where does Bahrain stand in comparison to the region and the world?
Well, as was mentioned, Bahrain is the country number 13 that has gone through this evaluation, and we are not comparing countries, we are not making any ranking list, but I must say that the delegation was very impressed by your national capacities. And out of the 19 different technical areas, Bahrain achieved what we are calling as sustainable capacity, the highest possible marks on many of those areas.
That's definitely good to know.
Yes.
And what do you advise health officials in Bahrain to do to further improve services related to health security in the kingdom?
Well, we were able to identify a number of technical issues, but as I said, the overall capacity is excellent. We were extremely impressed by your immunization system as a good example. You have a very good capacity to detect different diseases, also chemical and radiation events. So I would say that most of the items and issues that we were able to identify were improvements to already good capacity.
Well, I'm sure everybody watching will be very glad to hear that. Dr. Tanali, thank you so much for joining us, and we hope you've enjoyed your visit here in Bahrain.
I have indeed. Thank you.
Thank you.